Hey guys, are you an acupuncturist? Do you know how to treat acute stroke patient? Now, I'm going to show you when there is an acute stroke patient and how do you take the step to get immediate results to save their life according to Chinese medicine and acupuncture. Stay tuned.
Hi everyone, I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now I'm going to show you some technique how you can save life. If your friends, family, or an elderly person that in your family that around you that actually suffer from stroke, immediately what can you do? All right. So in acupuncture and what sort of needle that at home that you can use, I'm going to introduce all this to you, and you may save a life. Now, the first thing that you need to do is actually call the ambulance. Right. Step 1, call the ambulance. Step 2, and then you can do the following step that I'm going to introduce to you.
To do this, grab the hand like fingers like this, and then you're going to get the needles and put it in here on the fingertips. And what sort of needles you should use, I'll introduce that. You can use lancet, which lancet we use it for blood sugar test. Move the plastic, and that's the needles, as you can see here.
Now, in general, we use this as an acupuncturist for that. Use a lancet to bled to take the blood, right? But you may not have this kind of things at home, right? Unless you you have family members that suffer from diabetes and they have this, happen to have this at home. But what can you do is using sewing needles, any kind of needles, and those needles that you can put on your like at home that you can like use it to pinch the clothing, things like that, right? So in general, you don't actually need to steroid it, right? Okay, but if you worry about that, as long as it's not what do you call it, rotten, so you can still use that. If you worry about that, get infection or things like that, and normally it won't happen because you are actually squeezing the blood out, so it won't happen like that. But if you worry, get a lighter and to get the needle and to heat up the needle first, and then you can do that, right?
So as we said, mentioned before, you get patients to do this fingers and put on that way, and then you needle it, right, and let the blood out. But for that side, in the case of my mom, is on left side she'll be able to do that, right? On right side she won't be able to do that because she won't be able to do this movement. She'll be able to do that, right? So what you do is actually you get it one by one and then squeeze one finger, then the others, and one after the others, right? So you can get the other person to do on that side and you do it that side. If you don't have two person at the meantime, you have to do it all yourself. Well, it is it will be a bit painful. Now my mom is recovered quite well, and I'm still doing this treatment for her, so I'm using this lancet paint. For that is much less pain and pain-free, or you could say that. So okay. And the lancet is inside of this. So of course, when it happens, you won't have this kind of tool, right? You just needle it straight away on the fingertips. So don't worry about patients suffer from the pain, right? Don't have to worry about that. You're saving a life. I've used this lancet to pinch all the fingertips now. So what you can do is just squeeze it all together. This will be faster, and squeeze the blood out. You see? Then just do this, right? So you can squeeze it and keep doing it until the patient conscious or the patients feel better, get as much as you can out of it. Like my mom on the right side is the effect side, right? On that day, and when we did that, and she couldn't do this, so we have to do one by one. And if you do it one by one, you just have to squeeze like that, one by one, just like that, and then wipe it off and do it again. Yeah, you're gonna save life by doing this. Okay, so you must do that. You must remember to do that. If the patient's unconscious, what you're gonna do is you can use a lancet and to needle here, which in the bottom of the nose and at the top of the lips, between that, in the middle of between that. Okay, you can needle that. If you don't want to needle that, that's okay too. So just use your thumb and press it very hard, and then patient will well, if they're unconscious, and they will definitely awake from that. Okay, you press it very hard. Okay, but we didn't need to do that because my mom was conscious when that happened. So the next thing is doing the earlobe. So use the needle and pinch the earlobe 2 or 3 times, right? And then squeeze the blood out. Squeeze the blood out. About two times in here. So then just squeeze the blood out, okay? And then you can squeeze about more than 10 drop of blood out. I finished the left ear. I'm doing the right ear at the moment, but I'm holding a camera. If I can do both hands, and I'll be better for that. The next one is 220, bleeding 220 on the top of the head. So this, I won't suggest you to do that because you may worry or needle here and get the blood out, and you're gonna touch the head and you worry about it. So don't have to do that. You just keep doing the fingertips and the toes tip in the earlobes. And for that video, if you're an acupuncturist, hey, this is the thing that you should add on into your treatment, right? So for the acupuncturist and yin tang, straight away come up to here and both ear, the top tips of the ear and going up there and here. So you use lancet on 220, around 220, just tip it like this for about 10 times or more than 10 times. Then you both hands on the side and squeeze the scalp to the center and squeeze the blood out. Then wipe it and keep squeezing and wipe it. The last one is bleed the tips of the toes, all the toes, and then just squeeze one by one. All right, squeeze a lot up. That's the last step that my father is doing on this side at the moment. It's very simple, so anyone can do that. So we do all this, and then this is the last step, and then your patient should be you save the patient's life. You see a lot of blood came out, but that's just a little bit. It's not huge. There's no dangerous at all.
Right. You see, this is all simple, right? Very simple, and you should learn it. If you're an acupuncturist, you need to know how to do all this process. If you're not an acupuncturist, you need to learn this. Okay, I'm gonna give you a conclusion. Right, the conclusion here is: number one, if anyone around you happen to suffer from a stroke, what you're gonna do is, first thing, call the ambulance. Right. Second, while you're waiting for the ambulance, find a needles. Any kind of needles will do, right? Then, as long as it's not rusty one, right? And the first way to go is all the fingertips and squeeze all the blood out. That's the first thing. The fingertips, right? If the patient's unconscious, fingertips. If they're still conscious, fingertips, right? If they're unconscious after the fingertips, wow, they're awake. They can talk. That's great. If they still can't talk, don't worry. If they are still unconscious, don't worry. Go to 人中, this point, right? We talk about it. If you're not quite sure, go back to that. Second. Third, earlobe, bleeding on the earlobe. Where a woman put the earring, right, over here. Put a few more points and then squeeze the blood out. 3, right? Number 4. After all this, fingertips here, 人中, and go to all the tips of the toes. Blood lead then, right? Bleeding all the toes tip, right? Important. Now, when you do all this,
if you're an acupuncturist, 220, bleed 220. If you're not an acupuncturist, forget about 220, because that worry, you don't know where exactly the point is. All right. Then what happens if you're not an acupuncturist? You need to contact an acupuncturist as soon as possible. So ambulance came, send them to hospital, they have to do CT scan, whatever, just follow them and request an acupuncturist to assess, to give needles straight away. All right. The early the acupuncturist come for acupuncture, the better. All right. And I work out that will give the most speed. It will speed up the process, Then, like my mom, all right, she's good on the first day. It doesn't mean she fully recover. She can move, she can do things, there's no pain, all good. It doesn't mean she's fully recover. I get her to get rest for the next 2 weeks. Today is day 6. By the way, I'm going to put some video after this about how happy she is. She can move her hands or whatever. Right, and then I still do 2 acupuncture daily for my mom, and I get my dad and my mom bleed her fingertips herself, and that to help him as well. So I just do acupuncture for her. So as the next 2 or 3 months, she'll recover, fully recover. Okay, it does take time. Right? So stay awesome, and please subscribe to my YouTube and share this video to your family, to your friends, post on your Facebook, social media. Then turn on the notification ring bell. Stay awesome. I'll see you next time. Bye bye.
頭先背啊，我都會啊。
頭先啱啱頭先
喲，堅㗎自己，你掹手掹啊？你掹手掹？
頭先條筋做阿豆潮都這樣喎。
你想跳？你慢慢就撩門